A new era for mind-body medicine. This is printed in the National Library of Medicine, the National Institute of Health. Author manuscript peer-reviewed and accepted in the the New England Journal of Medicine. And the manuscript is available in PMC. 50 years ago, meditation was considered fringe. The idea that it had any role in medical treatment, absurd. Nevertheless, one of us published research demonstrating that meditation and similar practices, initially from India and later from other cultures, reduced oxygen consumption, lowered blood pressure and heart rate, and initiated a cascade of physiological effects that were the opposite of what occurs during the stress response. This coordinated set of physiological changes was termed the relaxation response, and a general secular procedure was described to elicit it. Coincidentally, this work took place in the same laboratory that had been occupied by Walter Cannon 50 years earlier, when he described the stress or the fight or flight response. Today, meditation and other mind-body practices, such as yoga and mindfulness, are growing in popularity, with 14% of the U.S. adult population reported having used these techniques within the previous year. Historically, these tools have been used to promote human flourishing, insight, peace, enlightenment, and connection to something larger than oneself. Today, many people are drawn to these practices for their perceived physical and mental health benefits and stress relief. All religious traditions and cultures have some form of meditative or other mind-body practice, but current explosion of interest in these practices has largely occurred within a secular context. Concurrent with this growing public interest is emerging research describing the neurobiologic, physiologic, and genomic changes associated with mind-body practices, particularly meditation, including activation of specific brain regions, increased heart rate variability, suppression of stress-induced inflammatory pathways, and increased tolerance. Some of these changes appear to occur with multiple techniques, others may be technique-specific. More research is needed to understand the implications of these findings. In 1964, Don Solkley and colleagues concluded that 60 to 80% of visits to primary care physicians have stress-related component. 60 to 80%. Stress is ubiquitous, and its role, when excessive or persistent, is a major contributor to morbidity and mortality, is well recognized. At the Bentham Institute for Mind-Body Medicine at Massachusetts General Hospital, we routinely receive referrals to our stress management and resiliency training SMART programs from primary care physicians and specialists who have seen their patients benefit from these practices. As many patients are initially skeptical, we counsel them regarding how stress may exacerbate in their symptoms, how mind-body techniques reduce the stress response, and what to reasonably expect. Example, you cannot blank your mind with meditation, and mind wandering is normal. With guidance and consistent practice, most patients feel less stress, experience a greater sense of well-being, and are less bothered by the symptoms of the myth. So, a great sense of spiritual connectedness. Belief in these techniques is not necessary to realize the benefit. Indeed, randomized controlled trials have suggested improved health and quality of life in multiple physical and mental health conditions that are related to and or exacerbated by stress, including chronic pain, anxiety, depression, cancer-related fatigue, tobacco addiction, inflammatory bowel disease, and cardiovascular disease. These tools may be helpful in the setting of substance use disorder. Moreover, preliminary findings suggest that integrating these tools into the healthcare system may reduce healthcare utilization and be cost-effective. Nonetheless, not everyone is ready to embrace these tools, and some patients may have concerns about certain practices contradicting their religious beliefs. Others are not ready to engage in the effort required to maintain a good practice. Still, others have been conditioned to request a pill every minute. Moreover, some patients may not be appropriate for these tools. For example, patients with several mental illnesses may have difficulty learning these skills and resisting touch with reality when they engage in some of these practices. Despite these barriers, many patients are keen to learn more about these tools. Given the available data and the favorable side effect profiles of these practices, We believe that mind-body medicine should be recognized as potential primary and secondary prevention and routinely incorporated into primary care. It is not so considered because our healthcare system is to a large extent predominantly built on a reactive disease system model rather than a proactive health enhancement model. Realization of potential cost savings and health improvements supported by mind-body medicine would require insurance companies to cover these services and educational system to train healthcare professionals in the appropriate use of these tools. Many medical schools now offer mind-body medicine electives, and only a few have made education in these practices a required part of the curriculum. Currently, few Americans have access to these tools in the medical setting, and even those who do must often pay for them out of pocket. Given the ubiquity of stress, high rates of anxiety and depression among young people, the necessity of learning effective coping skills as part of an essential health-promoting lifestyle, a need is poorly addressed by our current education system. It also makes sense that these tools to be widely integrated into primary and secondary education. Schools that have incorporated these tools have noted improvements in cognitive and social emotional outcomes for students. In addition to the potential physical and mental benefits of meditation, there's also potential societal benefits. Meditation and related tools can promote empathy and mindful presence among healthcare professionals, thereby enhancing the quality of life. Historically, cultivation of these mindful and contemplative practices throughout a society promoted tolerance and mutual understanding, enhancing the social fabric. Research suggests that on an individual level, mind-body practices can promote pro-social behavior. Good wide-scale use of these tools by people spanning the various socio-demographic strata of our country will promote healing of some of the divisions that currently challenge us. Western medicine has produced revolutionary health benefits through advances in pharmacotherapies and procedures. It now faces enormous challenges in battling stress-related non-communicable diseases. More Americans than ever are taking prescription medications for chronic health conditions, many of which have a lifestyle component. Chronic pain, often perpetuated by psychosocial stress, has become an epidemic that our pharmaceutical arsenal is poorly equipped to handle, and medical costs continue to soar. Mind-body therapies can be a helpful adjunct in managing chronic pain and other stress-related non-communicable diseases by fostering resilience through self-care. Though they are not a panacea, they can do much to improve well-being and reduce symptoms and the physiological effects of stress. These unused tools thus have much to offer on both the individual and societal levels as we continue to develop models for integrating these tools into our healthcare and education systems. We have an important opportunity and obligation to study these experiments so that we can learn how best to personalize the approaches and maximize their public health potential. We need to understand whether particular approaches are more likely to help certain people, temperaments, or conditions, whether psychological or genetic factors predict who will respond best to certain practices, what constitutes optimal dosing, and to what extent these practices can shift the course of disease and reduce the need for pharmaceuticals and expensive tests and procedures. More robust, well-controlled prospective clinical trials are needed, as well as additional implementation and comparative effectiveness trials, and research into the putative cellular underpinnings of mind-body health effects. There is so much work to be done. We believe the future is promising for mind-body medicine.